All right, I'll go ahead and get us started. Well, thank you to those who are in attendance, and thanks to those who are watching the recording. We're so glad to have you join us today for our Master of Arts in Bioethics and Medical Humanities presentation about exploring health beyond biology. We're going to talk about health, illness, and wellness, really focusing on social medicine, health humanities, medical humanities. You'll hear more about that in a little bit. Just some housekeeping things. So I am Dr. Leah Jeanette. I'm the Assistant Director of Education for Bioethics and Medical Humanities and a Senior Research Associate in the Department of Bioethics here at Case Western Reserve University in Cleveland, Ohio. And just a couple of things that we're going to cover today. We're going to talk a little bit about Case Western Reserve. We'll talk about medical humanities and social medicine. We'll do an overview of our master's program and how our medicine, society, and culture concentration fits within that program. We'll talk about the application process and deadlines. We'll talk about student assistantships and financial aid, and then we'll leave it open for some Q&A at the very end. If you have a question, feel free to submit it through the Q&A feature here on Zoom. We're happy to kind of pay attention to that. We can either answer as we go or save it to the end. And the last bit of housekeeping, I'd like to introduce Dr. Eileen Anderson. She is the Director of Education for Bioethics and Medical Humanities. She's an Associate Professor of Bioethics. She's also the Director of the Master's Program, Director of our Medicine, Society, and Culture concentration. Dr. Anderson, thank you so much for joining us today.
It is such a pleasure and privilege to be here. Thank you for hosting us, Dr. Jeanette.
So, Dr. Anderson, do you want to tell us a little bit more about your background and kind of being in this world of bioethics and medical humanities as we kind of jump into this topic of discussion today?
Sure. Well, I have actually a pretty unusual background in that I came to bioethics a little bit later through the vehicles of medical, health, humanities, and social medicine. And we're going to talk about what all those are. But all those things, whether we're talking about medical, social sciences. So for example, my heart of hearts, I'm a medical psychological anthropologist. I also do have a doctorate in human development and psychology. Did a postdoc in developmental neuroscience and have been working in this interdisciplinary space since. The synergy with bioethics, which we really started to expand at the university about 10 years ago, and now we have the concentration in medicine, society, and culture, and we are actually having a big celebration on campus this week because we now have a center for medicine, society, and culture, and we'll talk a little bit more about what those are. But any question in the medical humanities, arts, or social sciences has questions of values at the heart of it. And so does bioethics. And so the synergy between and among these fields has been fantastic. So the easiest way to say, what is all of it's a lot of words. So what is all of that? It's basically the non-biological parts of health and healthcare. So what is the political economic structure that we are set in? What is the culture of the place we are working in? What is the social structure and social organization? Those are some of the social science type of questions that we ask in social medicine. Then we ask questions about what is human behavior? What do people actually do when they have a health problem? How do they seek health? What kind of public health behaviors do they do or not? So for example, during the pandemic, the question of do you wear a mask? Do you not wear a mask? That's not a biological question. That's a social, sometimes political, and human behavior question most of the time. We also engage looking at humanistic ways to understand health, healthcare, illness experience, suffering, and healing. So we may look at things like narrative medicine. We may look at film or theater, and how that can communicate a lot about patient experience or healthcare organization or things like this. Disease spread. So you can think about, for example, all of the literature on pandemics that people have been turning back to or writing now that help us engage and understand what's going on a little bit better. So there are many aspects. It is an interdisciplinary field. And as we will talk about, why don't we start talking about Case Western Reserve, because we are unbelievably positioned, well positioned to do this work. So the Case Western Reserve campus is in Cleveland, Ohio. And our Department of Bioethics and our programs in Bioethics and Medical Humanities are located within the Case Western Reserve School of Medicine, which is #1 in the state, ranked out about number 24 in the US. We just came up higher than that for research funding and NIH funding. And we actually are in the top 10 for education and value added in education. So that's always really exciting. And we are also, though, one of 8 schools at the university. So when you are in our program in Bioethics and Medical Humanities, you have access across the entire medical school. And as we'll talk about, you also get access to the hospitals that are near our campus, some of the best in the world, our museums, our other cultural partners in the region, and a lot of regional resources. We also partner with all 7 of the other schools at the university and have faculty affiliated with the medicine, society, and culture concentration that allow students to follow their passion. So if you are interested in medicine and music, you can work with one of our music faculty as well as our bioethics faculty. If you're interested in medical history, you can have access to one of the best medical history museums in the country that is on our campus. And you can work with medical historians and so on and so forth. Sometimes we get students who are interested in going on into something like dental medicine or nursing, biomedical engineering, all of these things. Health law, we could probably list 100, but we have collaborations all across the campus, which is just an incredible opportunity. And it gives students access also to support services. We have a wonderful office for graduate education in the School of Medicine. There are also resources at the university level. So most students end up feeling like anything they need or anything they can dream up, there's a way to make it happen. So I've already talked a little bit about what are medical humanities and social medicine. And so I'm going to talk a little bit more about why they matter. They matter immensely because they shape the fields in which our healthcare systems are created. They shape and constrain policy and practice and give affordances to. They interact with public and global health. They teach us how to understand patient experience and human behavior, professionalism, and questions about what do you do, for example, when you have limited resources. So for example, in the COVID-19 pandemic, has been a lot of concern about limited access to ventilators. How do you choose who gets care and who doesn't? How do we put safety nets in for people who don't have health care or health insurance? How do we create policy around different concerns about access to health care, social justice, genetics, genomics, all of these new medical technologies? So there are these big questions about structures. There are policy questions. There are behavioral questions. There are values questions. And then there are bedside questions. There are clinical ethical questions where when you're deciding what to do with a difficult case, maybe at end of life, understanding culture, understanding religion, understanding family dynamics, all of these might be important to making the best possible decision for this particular patient. So one thing I want to flag right now is you can tell we have a very broad field. We have a very broad faculty. And one of the exciting things about this particular program is that we have a core curriculum that everybody goes through, which we'll mention, but you work with an advisor who has knowledge in your area of interest, and you can really personalize your educational trajectory to make sure you are getting what you need. One of the key ways we do this is through concentrations. So we have this medicine, society, and culture concentration where you are taking additional coursework and a deeper dive into some of the literature in medical humanities and social medicine. You are doing different kinds of practical work, gaining exposure to the diversity of types of work in these fields. And you are specializing your capstone and possibly even your practica experiences to make sure that you are focusing on your interest, whether it's social justice, it is understanding humanistic practice, or perhaps even arts and medicine. So as we know, we're asking, why should we study all these things? Why don't we just need to learn the biology? Healthcare impacts us all, as probably everyone has plenty of experiences, either with healthcare, with good healthcare, with problematic healthcare, or with lack of access to healthcare. And we have these constant advancements in science and technology, and unbelievable advancements in medicine and molecular medicine, personalized medicine. Looking at some of our, I was just in a meeting with one of our biomedical engineering faculty who does neural prosthetics, all of these exciting things. But we sometimes have to ask, not can we do something, but should we? If we have a very expensive technology that can enhance somebody's quality of life, how do we distribute that in a way that is just? How do we choose who gets access and who doesn't? What kinds of values should inform our policy and practice, and why and when and always? Who gets to decide? And how do we ensure things like justice and respect for people in research and clinical practice? So these are some very big questions. And as our technology, our robotics, our automation become better, these questions of not what can we do, even though we love to think about those and ask those and participate with those, but what should we do and how should we do it, are becoming even increasingly more important. So we get asked a lot, how does bioethics and medical humanities help a student's career path? There are so many different ways, and our students who come to this program come to us from a huge variety of backgrounds. They may be aspiring clinicians, maybe a doctor, maybe a nurse, maybe a PA, maybe a naturopath. There's a huge swath of backgrounds. Or they may be wanting to go on and maybe do health law. So we have students who are coming in for our program and then going on to law school, or going on to complete a PhD in perhaps sociology or anthropology or literature. We have students who want to go on and do things like research ethics administration, or who want to go on and work for a nonprofit, or maybe a governmental organization or a non-governmental organization. So our students get this interprofessional, multidisciplinary exposure and experience that for all of these different pathways is valued and valuable. Our program helps people launch their professional careers, advanced education in all of these different fields that are mentioned, such as that I have already and on the slide, like clinical and legal professions, regulatory work, arts and humanities, social sciences, bioethics and academics. And an amazing part of this program is we get a number of students every year who say, I don't know what I want to do yet. I know I want to help people. I know I want to work in health. I know I want to work in healthcare, or I know I want to work in social justice, health work. And in this program, they get such an exposure that it helps people discern the next step, or they get exposed in a hospital to jobs and career paths that previously they didn't even know existed. So it's also it's a great program if you know exactly what you want to do, and then you can hone in and specialize, or you can do a more general sweep and really work with your advisor and your professors and faculty and staff and peers to discern, what do I want to do? So our program is pretty special. We are celebrating our 27th year, which makes it one of the oldest programs in the country, and one of the strongest. We have different options. Most students will complete the 1-year program, which is, typically ends up 9 months in 2 semesters. We also have part-time options available, which people sometimes choose because they are working while they're doing the program, or they're doing a dual degree, or there are other reasons why they have other kinds of obligations. But the majority of our students will do the full-time intensive 1-year program. We have a customized curriculum, as I was talking about, that consists of 30 credit hours. 13.5 of those are electives. So that's where you can really personalize. And you can take courses within our department. We have a robust course selection every semester, but you can also take courses across the School of Medicine or even in other schools if you and your advisor decide that's the best thing for you. We have some awesome short-term study abroad immersive programs. So for example, we just had a full class go to the Netherlands to study public health there, which was quite successful. We're so excited to have relaunched our international and travel programs after being shut down during the beginning of the pandemic. So there's many different ways to create your credits and personalize your educational pathway. And advising is really important. It's something we take seriously. So you will be matched before you arrive on campus with an advisor. And you can always switch advisors or gain additional advisors, depending on what's right for you and who's the right person for you to work with. We have quite a number of dual degree options, which tend to shorten your credits. And in order to pursue those, you need to apply to our program and to whatever the other program is, be accepted to both. And then we have lots of experience in helping students work out which classes to take when to complete both of their degrees. So our educational offerings at the current time include the traditional program, which is the one I just outlined with the 30 credits and 13.5 of personalized electives, and the medicine, society, and culture concentration that we're talking about, where you would do the additional foundations of medicine, society, and culture seminar in the fall, co-taught this fall by myself and a medical historian. And that is a lively seminar that goes through the major themes in these fields. We read things from novels to classical social science to contemporary theory. It's a wide range to make sure that you have the tools you will need to do humanistic, social science, and arts analysis and communication. Then we have another elective in this concentration that involves an intellectual breadth. So each student works with their advisor and with myself or Dr. Jonathan Sadowski, who is the Associate Director of Medicine, Society, and Culture. And you create an experiential course where you are actually attending events all over the campus and beyond. In fact, last night we had a humanities festival play that some of our students were attending that was about health and health access and health equity. And then there was a discussion afterwards. So you find different events, different lectures, different experiences, sometimes national Zooms on different topics in these fields that you write up and submit. And then we're going to talk about the clinical rotations, but all students in the traditional program complete 160 hours of clinical rotations in one of 4 major hospital systems that we have relationships with. And most students will do 1 public hospital and 1 private hospital. And in the medicine, society, and culture concentration, you have some additional options in case you are more interested in public health or a free clinic, federally qualified health center, a research project. It would really depend on your situation. Then our research ethics concentration, which you actually can do, we've sculpted the schedule so that you could actually complete both of these, which a couple of students every year will do. Also has a foundational fall seminar in research ethics and a 1.5 credit, a kind of half course that is a journal club looking at contemporary issues in research ethics. And then in the spring, instead of the clinical rotations, you are actually embedded doing hands-on research ethics work. So you might be working in an IRB or with a research project or something like that. So I think we can just keep going because I've already talked about that. Dr. Jeanette, you're the course director for the clinical ethics rotations. So why don't you tell us a little bit about them?
Absolutely. So our clinical ethics rotations have been a hallmark part of our program since the very beginning. We consistently hear from our students that they rank this as one of the top reasons they either choose our program or they enjoyed our program or it helped solidify a direction for them. So students are able to spend 160 hours inside the teaching hospitals here in Cleveland. We have 4 major teaching institutions that all are partnered with Case Western Reserve, Cleveland Clinic, Metro Health, the VA Medical Center, and university hospitals. Each one has their own unique area of expertise. Each one has their own clinical ethicist. And students are then assigned to a specific hospital in the fall, a different hospital in the spring semester. And so you get to experience 2 out of the 4 hospitals during your time. When you're in these hospitals, you're attending morning rounds, team rounds, consult teams, you're going to committee meetings, and you can even go one-on-one with healthcare professionals, whether it's visiting patients, attending meetings. It could be going with an attending, it could be going with a genetic counselor, a chaplain, a social worker, a nurse. There's such a variety to the people that you're rotating with, to the different types of disciplines you're exposed to. So it could be anywhere from transplant to pediatrics, to geriatrics, to surgery, to trauma, to emergency medicine. So it really gives you a breadth of experience and a depth to opportunity. And the goal is that students are the ones extracting the ethical issues from what they're observing and they're participating in. And so on a weekly basis, you take cases back to a group meeting and you sit down with a clinical ethicist from that hospital site and your fellow students, and you talk about what you've experienced. Sometimes several students have seen the same patient and you can see a progression. Other times you're trying to wrestle with, well, why does one hospital do something one way and a different hospital do it a different way? And sometimes it really highlights cultural differences between hospital institutions. So these are fantastic ways for students to really dive into a meaningful way into the healthcare system and really see the application of clinical ethics.
Thank you so much. And I would agree. What we hear from our alum, we have many alums at this point, that is a highlight for them, as are these short-term study abroad electives. So perhaps you can say a word about those as well.
Yeah, so as Dr. Anderson mentioned, we are so excited that we have officially relaunched these. Our first course just got back from the Netherlands just over a week ago, which is amazing to be able to officially say they've relaunched. But what's great about these is they are ways for students to not only incorporate learning more about a specific area within bioethics and medical humanities, whether it be end-of-life issues like euthanasia, or public health issues like drug and detention or decriminalization concepts, or more humanities issues like environmental ethics and how that impacts human health. Students can choose to go on these courses based on the location that it's being held or the specific topic itself. Then it allows for cross-cultural comparison. So there's amazing ways that these programs really add to the value of the program itself, but add to the students' knowledge base and experience. And of course, they count as 3-credit electives for the program itself. And they travel actually during winter break, spring break, or in May as soon as the spring semester ends. So they're a really unique way to incorporate as part of the program without taking away, a whole semester. They really incorporate well.
Thank you so much. And yeah, and for medicine, society, and culture, a lot of our students will do those because there's no better way to understand culture than be immersed.
Absolutely.
It's great. So tell us what you need to apply.
Sure. So for an application, we ask for transcripts from all undergrad and grad programs. We ask for a personal essay. What we're looking for in that personal essay is just 1 to 2 pages. Typically, what we're asking students or applicants to write about is, what is your interest in bioethics and medical humanities, and how does this fit into your career path? And that could be a very specific direction, but it also could be that you're in that discernment category, but we want to hear from you. We ask for a CV or a resume, and we ask for 2 letters of recommendation, including one from a faculty or a professor or instructor that you've had. Once we have that completed application, it's then reviewed by an admissions committee member, and you would be interviewed by someone on our admissions committee as well. We interview all applicants because we want to get to know the applicants more than just the materials that you submit, but also be able to speak to you about your application and your interest as well. In total, once we have that completed application, it takes approximately 2 to 3 weeks for us to render a decision.
One of the amazing things about this program that is unusual at the master's level is that we do offer competitive student assistantships. So these are for students who have financial need, and they are competitive. And the earlier you apply, the better on these, because we do reach a limit. But these give master students opportunities to assist and in return get tuition remission. So some of our students will be assisting teaching undergrads. Some will be assisting on research projects. Excuse me. And for example, I have published with some of my students who have assisted in research, actually, and one in teaching when we wrote about an innovative class, or program and administrative opportunities, kind of depending on what is the departmental need, what is your interest and strength. And then, of course, students can also apply for all the regular vehicles of financial aid. We've got a good financial aid office who will try and work with you to figure out how you can fund your education. And there is work study on campus. So if you are interested in the financial aid office, that would be through you can just look up the financial aid office at the university or have us point you in that direction. Our department is the one who runs the assistantships, and tuition information for the upcoming year is available through the Case Western Reserve School of Graduate Studies.
So in terms of a time frame, we are currently taking applications right now. So our next deadline is May 15th. It's our priority 2 deadline. What that means is if you submit your application by May 15th, of course, we are able to review and get you a decision rendered within 2 to 3 weeks, but it also means you're eligible for the student assistantship deadline on June 1st. And so that's a big deal. So a lot of students try to get their master's applications submitted by May 15th in order to be eligible for student assistantships. So that's a big one. Of course, if you're simply just trying to hit our final deadline, that's August 1st. And so we take applications all the way up to that point. And so with rolling admissions, we'll just continue to keep reviewing as they come in.
Dr. Jeanette, we have a great question in the Q&A that I think is relevant to answer now. It's about, are there any options for non-traditional students who have been out of school for years? Do they still need faculty recommendations?
You're absolutely right. That's a fantastic question. So what I would say is, for the most part, we do like to have some type of faculty or instructor or professor recommendation. But for non-traditional students, that's something that we can talk about on an individual basis. And I think
absolutely
the best way is for us to just have a conversation of who in place of that faculty do you think would be a good fit? Is it someone that has known you for a long time, but can still speak to whether you can do graduate level work, or understands your interest in bioethics and medical humanities? So there's ways that we can talk about, the appropriate person to write a recommendation that may not necessarily be a faculty for our non-traditional students. So happy to speak more directly to that, question. Students can reach out to us, bioethics@case.edu, and we can speak to that specific circumstance as well.
Thank you so much. Yeah, so in that case, and we do have non-traditional students every year. Students come from a variety of background, from fresh out of undergrad to being out in the workplace for a little bit and coming back, to retooling mid-career, to having retired and coming back. And it is to kind of refocus for another career. So for example, we've had MDs who then after clinical practice want to come back and really focus in on bioethics and medical humanities. So it is really exciting to have students learn from each other also. because not only do students learn from the very interdisciplinary backgrounds that they're coming from, but also different points in the life cycle, the career cycle. And those conversations tend to make our courses really rich and really be able to approach questions from so many different dimensions and perspectives.
So I'm looking to see if we have any kind of final questions, but I'm not seeing any. You know, one of the questions we do often get, Dr. Anderson, that I'd love to hear your response to as we wait to see if there's any final questions is why should a student choose our program versus other bioethics and medical humanities programs out there? And this is not meant to disparage any other program, but what do you think makes our program the reason they should choose it, I guess?
That is a wonderful question. And ultimately, we want every student to find the right fit for them. And that is one of the things that we're having a conversation about during your interview. But this program is so special. It is so unique to have the clinical rotations opportunities, the short-term study abroad opportunities, the research opportunities, the teaching opportunities, the access to faculty in almost any field, clinical or scholarly, that you could imagine. And the ability to gain exposure, professional networking. And we should add that we have about 1,000 alums working all over the country and all over the world, who you also, alums tend to really form an identity around with this program. It becomes part of who they are. And they almost always open the door if a newer alum or a student approaches them. Cleveland is a fabulous place to live. We hear all the time. I'm surprised I didn't, Cleveland can get a bad rap in the national news or international. It is such a livable city. It is affordable. Students have access to theater very affordably, orchestra, all kinds of concerts, sports, museums, Rock and Roll Hall of Fame, a national park, local parks, the lake. It's just a really high quality of life as a student. And our students tend to form community and do things outside of the classroom to go experience some of the richness of the surrounding environment.
Absolutely.
That's a short version. I could go on all night.
No, I wholeheartedly agree, though. So it looks like we're not having any more questions, so we'll go ahead and wrap up. Thank you, Dr. Anderson, so much for joining us today and providing insight into the Medicine Society and Culture Concentration and the Master of Arts in Bioethics and Medical Humanities program at Case Western Reserve.
Dr. Jeanette, thank you so much again for hosting us, and thank you to our live participants and those listening recorded. And this is the best way to reach us. At bioethics@case.edu. Please reach out with any questions you have, or if you're just wondering, might this be the right program for me? Are my credentials competitive? Anything you want to come and ask us. Could I study the following? Have you had anyone who did what I want to do? I have no idea. Whatever it is, please reach out and we'll look forward to talking with you.
All right. Thank you so much, everyone. Have a great rest of your day. Bye-bye.